raise your hand so I can bring more copies of the presentation. So welcome, Susan.
Good evening, everybody. As Liz said, my name is Susan Leninger, and I am the Deputy Director of Human Services for Stark County Job and Family Services. I've been with the agency for about 15 years now, in this capacity for about the last 5 years. And never in the time that I've been with the agency have I seen so much going on with our programs and our computer systems. So I'm really here tonight, hopefully, to be of some help in clarifying some of the things you might be hearing. There are 1,001 different versions of what is going on flying around the community, flying around various organizations, and what I want to do tonight is share everything that I possibly can with you that we know up till this point. And I will kind of go a little bit further in that and tell you that I promise you that something that I tell you tonight will change before things actually go into effect. The rules around this program and everything are not finalized yet. They have not been put into final draft and released out. They are being modified and worked on as we go. So we want to share information. We want people to kind of understand where we are and what's going on. But we very much also want everyone to understand that things are very fluid and are continuing to change. So as we get new information, we will put it out. On that note, for anyone who was already here when I got here, or didn't get a chance to see, I did put a white sign-up sheet on the counter over here, and it's got the Job and Family Services logo on it. If you would like to put your name and email address on that sheet, I can add you to an email group that I have at the agency that we use to send information out to anyone who wants to get updates as we get it. So as the state releases information or tells us they're putting something on the website, we go ahead and do a blast out to everyone on that email list. It's just under a couple hundred names right now, but I'd be happy to add anyone who's interested to that if you sign up on that sheet. So if there's materials that I use or things that we get new, those can be shared with you as quickly as possible. All right. I'm going to follow through my presentation in the order that it's on there. I can probably take a few questions scattered throughout, but definitely make sure that we have time at the end to go through anything else. Just let you know if there are any questions that I can't answer for you here tonight, I will write those down. I have a paper up here so that I can take those back. And again, that email is the format that I've been using to respond to questions. So if you're signed up on that, I will get all of the answers typed up and sent out via that email list. So I really just want to try to navigate anyone that I can through everything that's going on with Medicaid in Ohio right now. And one of the things that you'll kind of get the gist of as I go through this entire presentation is that the state of Ohio is really, really fond of rebranding things recently. So I might tell you that something that's currently known as this is going to be known as something else. They're renaming a lot of things, which makes it a little extra confusing. And we try to navigate and hit some of those things as we go through here so you can see what it might be the exact same thing with a different name that I'm talking about. So, for example, understanding Medicaid, Ohio's disability determination redesign. You may have heard the initials DDA, DDU, something like that in my agency. DDR is a new one, but they're using disability determination redesign to discuss the age, blind, disabled Medicaid categories, or ABD, if you've heard that terminology come out of my agency for the last 15 years plus that I've worked at the agency. We've called it ABD, and now they're having us call it DDR, so DD, disability determination. So I'm going to go through a little bit of an overview of what Medicaid looks like right now, what it's intended to look like after the changes around the ABD Medicaid categories going live. I'll talk a little bit about the Miller Trust information and what those look like. Talk about the next steps that our agency and staff are going through and what we anticipate going through with our community. And then a little bit of the system conversion stuff that's tied into the policy changes. I won't read this word for word, but just so you know, the state of Ohio operates under what is called 209B for their Medicaid determinations. And basically in the Social Security law, Paragraph 209 says that Medicaid has to be offered to anyone who receives SSI. But then if you get down to 209B, it gets a little bit more in-depth and says that states can also choose to be more restrictive than that, which is what Ohio did way back when they were given this option. So someone who is eligible for SSI does have to be looked at, but if their income is such that they are over a standard set by a state, they would potentially have to spend down. So 209B gives states the option to be more strict and allow people to spend down rather than just be automatically eligible for Medicaid. And that's what we've been doing for a really long time. For anyone who's not familiar with spend downs, it basically means that you're over the income threshold for the ABD Medicaid, age-blind disabled, and you can meet eligibility by spending down your monthly income in one of the 3 ways that are listed up here. You can have a recurring cost where you have ongoing expenses such that you always meet the amount of your spend down. That's common for people who have a regular monthly expense, but their spend down is not very high. There's a pay-in where you actually pay the money to the agency in exchange for the Medicaid card being released and the amount of that spend down. And as long as it's paid by the 15th of the month, you get your card for the entire month that you paid the spend down. And the final way is the delayed or the incurred method, and that would be if someone incurs bills through a medical provider that meet the amount of the spend down. And your card does not get released under that method until the date you actually meet the spend down amount. So if you have a spend down of $100, if you have one bill for $50 on the 1st or 2nd of the month, and you don't have the other 50 until towards the end, it's the date you actually hit the 100 that we can release the card from that date until the end of that month. For states that did not choose to go the 209B route with the spend down options, their other options were what are listed here, to go strictly with SSI criteria. So they have to align with the Social Security Administration for the SSI determination, but the state makes their own decision. The other option is 1634, which is what Ohio is moving to here this summer. And that is where we accept the Social Security Administration's determination, but we wait for them to make the determination of SSI eligibility for someone to become eligible for Medicaid. So there is no longer going to be an option for someone to spend down in order to get their Medicaid card on a monthly basis. The state does not do anything to redetermine someone's eligibility. We rely strictly on the Social Security Administration. The reason that the state of Ohio has decided to go in this direction is largely around fairness. As most of you may know, the state of Ohio did opt to take part in Medicaid expansion a couple of years ago, where we opened up eligibility for single adult individuals or married adult individuals up to the 138% of poverty, which was something that was not available prior to that. And the state was trying to look at ways that they could eliminate some of the nuances of looking at eligibility for adults in general. So that was one of the reasons that they decided to go in the 1634 route. They also had a lot of issues around fairness with spend downs, where someone may incur a spend down by meeting it with a bill, and then they became responsible for the bill that they used to meet the spend down. So, for example, if I had a $100 spend down and I got a $100 bill from my doctor, for me, based on what my doctor did, I might get my card released, and then my doctor would never pursue that $100 because I was getting everything else covered. But my neighbor's doctor might make my neighbor pay the $100 to them before they would, release a bill to have them get their Medicaid card released in any future month. So there's a lot of inequity and problematic treatment from medical providers, and just that whole billing process is very complex when you're dealing with the spend down process. The other reason is a lot of administrative simplification, and that has a lot to do with computer systems. It has a lot to do with processing. calculation of spend downs. It has a lot to do with when someone has a very high spend down, using months and months of bills or very high sets of bills to release cards. The state has decided that that is not something that they want to do anymore. They want to try to streamline the process around eligibility. So I'll talk to you a little bit about the spend down portion going away, but that's really not the only change in the reality of Medicaid in Ohio. So what I'm going to do now is I'm going to go down through and tell you what the Medicaid is going to look like once all of these changes are put into place. Since expansion went into place, we have had the term MAGI floating around the community. And MAGI stands for Modified Adjusted Gross Income. And that is the budgeting methodology that is used to determine eligibility for all children, families, pregnant women, and adults who are eligible under expansion Medicaid. We basically have to look at how people file their taxes, who claims who is a dependent on whose tax return, and based on that, we can determine whose income counts for who when we're looking at Medicaid eligibility. So that's been in place since expansion through the Affordable Care Act at the end of 2013. That will continue and that will not change. It'll look just like it has for the last 2 years now. Anyone who is on SSI will automatically be eligible for Medicaid when these rules go into place. So it doesn't matter what other income they have, it doesn't matter what else they've got going on in their eligibility in today's world. If you're open on SSI, you will come over into the new system and you will have Medicaid coverage. There will also be a lookalike category. So right now, for those who are not on SSI, but they do qualify for an age-blind disabled category, basically, if they're under the 64% of poverty, which is the about $634 a month for one individual, they can be on the ABD coverage. Anything above that $634 minus like a $20 disregard becomes the spend down. Now, since the spend down's going away, what they're going to do is they're going to increase the income guideline a little bit. And remember, this is non-SSI individuals. Those individuals already get the coverage. If someone's under the 75% of federal poverty level, which is 743 right now, they will also be eligible for Medicaid if they meet the age-blind disabled criteria. The resource limit is going up just a little bit from $1,500 to $2,000, but the spend down option will go away. So, anyone who is over that 75% and who does not somehow qualify for the MAGI coverage, which is up to the 138%, they will likely not be eligible for Medicaid coverage once the rules change. And they will be prompted to go to the federal exchange or to find coverage in another way. Now, I'm not talking about long-term care and things like that quite yet. We'll get there in a minute. But that is the basic fundamental change around the way that the initial eligibility is going to be looked at when someone applies or when we're reevaluating someone who's open now. Do they meet MAGI criteria? Are they open on SSI? If yes, they're open. If not, are they eligible for the ABD up to the 75% of federal poverty? And then we go from there. There's an additional package of services called, well, it's not called Severe and Persistent Mental Illness, SPMI. That's what it was going to be called. As I told you, Ohio likes to rebrand. You may have also heard the term 1915I floating around in the community, but the state has finally landed on specialized recovery services. There's this bundle of services that will be available to individuals who meet the criteria listed on the slide. So an adult who is 21 or older, whose income is between approximately 75 and 225% of the FPL, so under the special income level or the SIL of $2,199 per month, who, if they're within the resource limits and meet other criteria determined by some community partners who are going to be working in conjunction, similar to how Area Agency on Aging and DD do now, a similar type of assessment of an individual, they could potentially qualify for this additional package of services. And they're very much based on certain behavioral and life skill needs. In the state of Ohio, there are approximately Stark County, there are approximately 164 individuals who have been identified by the state of Ohio as potentially eligible for this. And letters have been mailed out. So if you have family member, friends, or anyone in your home or in community who has gotten a letter talking to them about SRS or Specialized Recovery Services, they are likely already kind of being funneled towards that extra package of services to go live whenever everything goes active in the system. I did have a stack of some FAQ sheets that were back on the counter. I think they may be gone, but I know that DD has let us know that they also have those FAQs on their website, and they're also on the Ohio Department of Medicaid's website. Additionally, if you sign up on my email list, I will also go ahead and send out to everyone from tonight the FAQ sheets that I referenced during the presentation tonight. But it does go through some FAQs around that program and what are the services and what are some of the things that will be looked at for individuals who would potentially qualify for the specialized recovery services. Right now, we have a program that's called MBIWD, or Medicaid Buy-in for Workers with Disabilities. That program will still exist, and for anyone who doesn't know, that is just where someone qualifies for an ABD Medicaid, but they also work in some capacity, so they have earned income. And that program allows them to pay a monthly premium in exchange for their medical coverage, and if they stop paying that premium, then the medical coverage will terminate. But that program will not go away whenever we go live in 1634 changes. Individuals who need nursing home or immediate care facility care or services under an existing waiver under 1634 will have an income limit of 300% of the federal benefit rate, which is about the 225 federal poverty limit, or the SIL, of $2,199 per month. And because no one will be able to spend down, individuals who qualify for the nursing home, long-term care, or waiver services will be able to open up what is called a qualifying income trust or a Miller trust in order to remain or become eligible for that type of coverage, the long-term care waiver services. It's not available as an option for individuals who are not at the level of care of long-term care or waiver. Just so you know, I know that I think Emily had said that she has a list of individuals who are currently working with DD on who got waiver, who would have to set up a trust. I think she said that she had about 15 individuals. For Stark County, there are approximately 190 individuals in the entire county who right now are open on one of those services and show above that income level that they will probably have to open up a trust. So just so that you know, it's not an enormous number, but for those who are, there are some plans either in place or getting put in place to make sure that everything that needs to be done can get done. Long-term care will look a little bit different to my staff when they determine eligibility going forward, and so things might look a little bit different to individuals who are dealing with us around long-term care, and I'll get into that in a little bit more. But I say that just to let you know that we kind of already do what this says, but it becomes more visible in the new system that we're going to deal with. When someone applies for Medicaid and long-term care services together, we first look at, do they qualify for a base Medicaid eligibility for something like MAGI or ABD, and then we go and we look at the long-term care or the waiver services. Now it will just be a little more broken out for my staff and in our computer system, and so you'll see some differences around that. But I want to let everyone know that this may impact what we ask for verification-wise from a household. And it could vary between two people who are sitting next to each other who think that they have very similar situations. So the best thing to do, if you have any confusion or questions around that, is to really deal directly with our staff person who does the eligibility, because they're going to be able to look very specifically at what your circumstances are or what the circumstances of anyone that you know who might be working with us are, and make sure that we're getting only what we need for that household. But I know that's been a big point of contention for some individuals. And I can give you an example. For someone who will qualify for waiver services, but they would also qualify for MAGI as their base form of eligibility. We may not need resources like we need for someone whose base kind of eligibility is ABD. So that is something that 1634 breaks out a lot more granular for us, and the requirements are just a little bit different in what we have to ask for. I'm sorry if that was confusing. I can try to clarify if there are questions later, but there will be differences. So for anyone who does have to set up a Miller Trust, I've tried to include just a little bit of information about what the Miller Trust is. And again, there was an FAQ sheet for this as well that ran out. I apologize. It is on the website for DD. It's on the Ohio Department of Medicaid website, or I will send it to anyone who signs up for emails. But a Miller Trust is a way for those individuals who are over that special income level to remain eligible for the long-term care or waiver services. And so if they have the income over the $2,199 per month and they have to set this up, it's done through a legal process, and the following characteristics have to be met. The trust can only be used for the income of the individual who is getting the Medicaid coverage. So a family's income can't go in, children's income can't go in. It can only be the income of the individual for whom the Medicaid is being explored and opened. It is irrevocable, so once it is set up, it cannot be dismantled, it cannot be taken down. It must be properly executed and name the state of Ohio as a beneficiary, and it has to allow for resources to be recovered by the state. There's a little asterisk down there that talks about the recommended language. Another handout that I had back that I will include in an email is a template for the trust that the state of Ohio is recommending be used for anyone who has to set it up. It's about a 2-page document. It just has a lot of places to fill in the individual's information, and we'll talk about how to get that set up. But they're trying to make it as simple as possible for those who do have to set the trust up. Once money is deposited into a trust, there are certain things that it can be used for. So this slide goes over those. Money can be used for incurred medical expenses, monthly personal maintenance needs allowance, bank fees associated with maintaining the trust, and patient liability for an individual if applicable. So if someone has a patient liability that they're responsible for a nursing home facility or something like that, if they choose to deposit all of their income into the trust, the amount that they're responsible for can be paid to the facility directly from the trust. And that would all be encompassed in the trust being set up. This is just a little bit of a flow chart to kind of show you what the process would look like for someone who has to go through setting up a trust. The state has identified those individuals, and if you are required to set up a trust, you should have by now received a letter in the mail. If you think that you are going to have to set up a trust and you did not receive a letter, you can contact our office, especially if you have a nursing home or waiver worker directly. They're probably the best resource for that. But letters did go out, I think last week or the week before. The state of Ohio has identified a third-party vendor who is available to anyone who needs to set up a trust at no cost to you whatsoever. They are being paid by the state to be available as a resource to anyone who has to set up a trust, and they actually should be there and available to support anyone who has to go through this process through pretty much anything that you would need, from transportation, dealing with the bank, filling out paperwork, having a legal representative review the trust, and they're called automated health systems. If you are required to set up a trust, a letter looking like this would have come out, and so again, if you think you should have gotten one, give us a call, and I can also attach a copy of this to that email, but it gives you the phone number directly for AHS or Automated Health Systems, and you can reach out as soon as now. But there's going to be some time to get through the process of setting up a trust. So they will help set it up. It needs to be reviewed legally. You do not have to use AHS if you have to set up a trust, though. If you have legal counsel that you prefer to use, absolutely are welcome to do that. If someone in your home or that you know you believe is competent to do that for you, that is your prerogative, and you can go that way. But AHS is an option at no cost. A bank account does have to be set up for a Miller Trust, and that is where the money has to be deposited. The information is provided to my office so that we can put it into the eligibility case appropriately, because for individuals over that income level, having the trust is a condition of eligibility since their income is over the threshold. The individual makes monthly deposits into the trust, and that'll all be set up through the process, and the trust is monitored. And as long as the income continues to be deposited into the trust, the eligibility criteria is met and the coverage continues. So right now, as I told you earlier, things are very fluid and things are changing a lot still, even leading up to this. So I kind of tried to go through and give you just some steps and how my staff and myself are dealing with what's happening, and just to share with you, and there's probably 1,000 other things we can go through if we need to. But the state is continuing to solidify the process for AHS to be available to everyone. They are responsible for assisting individuals in all 88 counties of Ohio if there is someone there who has to set up a trust. So they're really trying to get a little more meat to the services, the presence, and what that's going to look like. We have offered in Stark County that if individuals need to set up the trust and want to use AHS, to maybe host them at our building so that people can come in and meet with us or with the AHS there to do that. We're going to help try to coordinate transportation if transportation is needed for any of the process. We just have not heard a lot from AHS directly yet because they're trying to get some consistency across all 88 counties. AHS and then each of us counties individually are trying really hard to provide some education and support to the community. So you'll probably hear things from us, and you will probably start seeing some things from AHS come out, because that was part of their contract, is to be available as an education resource. My staff have been getting training very consistently on all of the changes. There are probably 4 3-hour trainings that all of my staff have to go through just on the policy changes for the Medicaid. And then they're also doing 2 to 3 full days of training on how to do that in the computer system that all of this will live in starting this summer, because the state never does anything in just one step. Not only are all the policies changing around the Medicaid eligibility, but we are actually moving it all into a whole different computer system than what it's lived in for the last 30 years, which is that CRISI system that you get those little DOS-based looking letters mailed out of. It's all square letters and everything. It's a very old system. It is outdated. Knock on wood, it's worked, but it's not set up to support the MAGI Medicaid nor the age-blind disabled. So we are, as a state, moving to a new system. And then I just reiterate here that the FAQ sheets are available and I can send those out. I was just in Columbus on Wednesday and Thursday of last week, and the Ohio Department of Medicaid is still working on finalizing all of the little details of the rules. So as things come out, I will share those updates through the email group. Changes have been targeted, and if you go and look at the FAQ sheet, if you picked one up tonight or if you look on the website, it says effective July 1st. And the reason I have stars there is because I'm not 100% sure if that's actually going to happen. And the reason for that is because the computer system conversion was also supposed to happen at the 1st of July, and they just told us on Wednesday that that's being pushed back. So we are kind of beating the drums, trying to get them to commit to us on exactly when the rule changes will be in effect. And then we're transitioning the programs into the new eligibility system. I don't know if this is interesting to any of you at all, but this is what it's going to look like for us to move the age-blind disabled programs over into the new computer system. It was supposed to happen July 2nd, 3rd, and 4th. Now it is not scheduled to happen until July 22nd through the 24th, which is why it makes it extremely complex to have the rules go live on July 1st, because the system that the programs are in do not support the rule changes. So we are hoping they're going to push it back till at least August 1st, but I will share that as soon as I possibly can. The following groups are the ones that are going to convert over when this happens, and that is everyone on age-blind disabled categories that are open now. So people who are having waiver or having nursing home services are included in that group. There is specific logic for individuals on spend downs, and I can share what that is with you. And let's hope they don't change it now because it's changed 3 times. If someone is open on a spend down and they have met their spend down 1 time in the last 12 months leading up to this conversion. So right now, I think they were going July 1st of 2015 through June 30th of 2016. They had to meet the spend down 1 time in that period. They are going to convert over to the new computer system as open and active on Medicaid, okay? And they are going to stay open and active on Medicaid until we have to run a redetermination on their case. When we run the redetermination on the case, if they are on SSI, if they're under the 75% or they're eligible for a MAGI coverage, they will stay open and go forward. If they're over those and not eligible for any of those categories, then that coverage will close at the time of the redetermination that's being run. Anyone who's open on Medicare premium assistance will come over active. If someone has applied and is pending with us but has not yet been determined eligible, they will convert over as an open pending so that we can continue the determination and open them back to the appropriate date based on their application. If someone has been closed or denied within the past 30 days, they're going to convert over to the new system, but they're still going to show closed. And that is so we can reopen them if they would reapply or requalify for coverage. And then anyone who has a history span back to February of 2014, so that if someone has been open on spend down for a long time, but they haven't met it for whatever reason, yet somewhere they have medical bills piling up that they never submitted to us so that they can meet their spend down, having this part convert over will allow us to go back and potentially open up spans for previous months if they had not gotten those bills to us. Again, things to consider. Things are very fluid, and so it's okay to get frustrated or angry. I do on a regular basis when things change, but I'm going to try to do my best through myself and my staff to share those updates as we get them. Customers and my staff are experiencing, like I said, an enormous amount of change right now. So if someone answers you incorrectly, if you're dealing with someone at my agency or you really feel like they're incorrect, please do not hesitate to ask to speak to their manager so that we can make sure we're doing everything absolutely correct for any of you who might be dealing with our office, or anyone that you know who deals with our office. One of the things that I kind of referenced about things looking different in the system, I decided to kind of put on here last minute before I sent this over. If someone is open on a long-term care or waiver program, right now in our computer system, they have 1 category of Medicaid that shows open, and that just encompasses everything they're eligible for. So it gets their base Medicaid, it gets their package of services for waiver or for nursing home or whatever. Our new system doesn't work that way. It breaks everything out, even in the system where my staff look at it. So if someone's eligible for, say, MAGI coverage as their base, and they're also eligible for waiver, they're gonna have 2 separate categories of Medicaid that show in their case and on any notices that will generate out. So notices are gonna start looking different when they come to you after everything moves over into this new system. I put that on here. Terminology will look different. You won't see those letters anymore like MAD, MAP, MAJ. You won't see those things anymore. You'll actually see the language around long-term care or waiver services, things like that. So there will be some things to look for. Even the envelope is going to look a little bit different in how it comes. So if you see things and you're not quite sure what it might be, open it up and see if it's what a new notice looks like from us. All right, that was a lot of information. Thank you very much for staying with me. Does anyone have questions that maybe I can answer to try to help clarify? Okay.
On the Miller's Trust, what was that income level you said?
It's 2,199. It's the current SIL or special income level that exists now for individuals when they go monthly. Yes, 2,199. And if that goes up, a notification would get out, like if the federal poverty tables get adjusted up, that would go out.
Does that include earned income and their social security benefits combined together?
Yes. And remember though, if someone's SSI, then they kind of step to the side of that and have coverage anyway.
Now, on the waivers. That'll help everybody.
On the level 1 waiver, is it going to be staying, when they get their medical card, is it going to stay the regular Medicaid as it has now, where they don't have to go over to the privatized?
I am not,
What do you mean by privatized?
yeah,
Well, like CareSource and
oh,
the Buckeye, or that's gone, but
no, my understanding is that the state of Ohio is on track to move everything to managed care.
that's not good.
I don't disagree, I apologize, I don't have a lot more information, but it is the intention for all programs that are open for Medicaid to go under managed care.
The resource test, again, that's changing from 1,500 to 2,000.
For the ABD, yes.
When is that effective?
That is whenever the 1634 rules all go into effect. So as of right now, if you look at anything out there, that's July 1st. We are really hoping that that is going to get pushed back. And one thing I should have said to clarify, and I think we have a question over here too. Because we're looking at having that waiver on redeterminations for 6 months, so if someone who maybe is over income really, but they never spend down in the last 12 months, they convert over as open. For that period of time that their redetermination doesn't have to be done, they kind of get Medicaid, but they're not eligible for that period of time. And we would not take an action to shut them down until they're due for that redetermination, if that makes sense. It's kind of a waiver period.
Yeah, he's on that buy-in, and he has a label, just a waiver 1. How is that affected in any way?
Talking about the, for someone who's working,
Yeah,
it should not, and it should convert over open just as it is now. So the MBIWD category, unless, well, it'll convert over that way in the waiver. So they'll both convert over open. Then when we redetermine, if you would become eligible for something different where there wasn't a premium or something, we always look for the most accessible category first. So that hierarchy is kind of the MAGI, the ABD, the Medicaid for buy-in for workers with disabilities, and then we go to the long-term care block. So we always try to get the hierarchy that's no cost or whatever to someone first, and then we have to go through that ladder. But whatever someone's open on at the time of conversion, that's how they will convert over to the system until we do redetermination.
okay, now we have a family trust for them,
Okay?
already set up. Now, would that have to change to another trust or anything for the adventure? or
Is
not?
the trust set up because of the income being over the,
Well, it's set up so that, when we're no longer here, that the money would be funded into it.
my understanding, and I will take this back and ask my eligibility experts so I can send this out in an email, is nothing would have to change to a Miller Trust unless someone's required to set it up because of the monthly income amount. So if they already have a trust that is deemed proper as far as resource eligibility for a Medicaid program, that does not have to be impacted.
Thank you. I have 2 questions, please. I'm over 65, so I don't think quickly like these young people do. I am not a payee, I am a provider, but I pretty much help the payee with all the necessary information. When you speak of our current pay down system, spin down, when and how do you determine did you determine that was required? Because you mentioned over the past 12 months whether or not a person had to do a spend down or not. Said it would still be open.
Okay, so, what the meeting of the spend down in the past 12 months has to do with is how someone is gonna convert over to the new system whenever that happens in July. So if someone, are you talking about someone who at one point was eligible without a spend down, but then had one? Or just the fact that they met the spend down through having services? What it is if anyone has a spend down and they actually met it and had their Medicaid card released to be used anytime in that previous 12 months, they are going to go over into the new system with Medicaid open for them. Okay, and it will stay open until their redetermination is run, and then if they continue to be eligible, it'll keep staying open. But if they're over income and not eligible for any Medicaid program, that is the point at which it would shut down.
All right. Did I understand you correctly that anyone currently on Medicaid or under managed care?
My understanding is that they're looking at putting everyone open on Medicaid onto managed care.
Explain managed care to us, please.
The 5 managed care providers that are available in Ohio who are basically like a medical insurance company who are responsible for coordinating the coverage of services. So your CareSource, your Buckeye, your United, I just lost the last 2. But those are meant to be the, instead of a fee-for-service card, they would get a managed care card and use that to cover their services. And they'd have to select one of the managed care providers.
So it's possible that a medical provider that currently accepts their card may not accept, wow.
That's not an impossibility. What I can do is the question that I can take back and send out in an email blast to anyone is, are there going to be any exceptions to having to enroll in managed care? And then if whatever answer comes back for that, I can share. But our understanding is their intention is to put everyone on managed care. I have not gotten a date for everyone being required for managed care, but I will put that in my questions as well.
On your, you ready?
Where is it? Oh, okay, yes, thank you.
On your frequently asked questions, that second page, it says questions, contact automated health systems. Is that you?
No. So that's on the QIT paper. So those frequently asked questions were done by the Ohio Department of Medicaid, and AHS is the vendor who has been hired by the state to help anyone who has to set up a trust. So that's what that contact number is. If someone has an individual situation question about themselves, they can call my office and I can, I'm not gonna tell you the right number, I can give you a number to call. I can read it to you now if you want me to.
If you remember.
Let me give you, it's 330-451-8639. That number would, 8639, that number actually rings directly to my assistant. And based on what your question is, we can make sure we get you to the right manager or case manager. Because I don't want to put you in
So we don't need to ask for anyone in particular, just tell them.
Yeah, I mean, if you're calling for someone that already has an open Medicaid case, then what we would do is look that case up, if you're an authorized representative, and get you to the right person to answer the questions. If it's a general question, we'll try to answer it right there.
Are these changes coming due to changes in state law, federal law, or administratively through the Ohio Department?
The changes are coming because of a change in state law. So the state of Ohio decided to adopt the 1634 Social Security rules instead of the 200.
When you say the state of Ohio decided again, that was legislative action?
It was passed through the House budget bill, I believe, all the adoption of the ABD changes. Just like it was the administrative push that had us expand Medicaid, but I believe it went legislatively for the ABD changes to adopt the 1634 rather than the 209B.
Hold on, there's one lady here. No, go ahead, we've been waiting.
I came because I wanted to find out about QMB.
Okay? just in general about?
Well, I mean, they just switched money,
Okay,
and now I'm getting bills,
okay.
and I wonder why. What's the difference?
There should be no change with QMB or SLMB. So, for anyone who's not familiar, QMB, SLMB are the Medicare premium assistance programs where if someone has Medicare premium taken out of their Social Security, if you're eligible for one, the category covers both your premium and the 20% not covered by Medicare, and the other one just covers your premium. I probably would have to have someone look specifically at your information. So if you want to come up to me afterwards, I can get your name and have someone call you to go through your case. But there have been no changes to that program, is my statement on that.
I have a couple of questions. First of all, I understand that those people who are subject to the changes already received some correspondence in the mail.
Yes.
So if we did not receive, meaning,
So the two correspondences that have gone out to individuals so far are to those who might be eligible for those specialized recovery services, and then for those who are potentially having to set up the qualified income or Miller Trust. So other correspondences have not gone out. I think the reason for that so far is because they don't anticipate that there will be much of a change for anyone else up front, because if you're open on a Medicaid coverage right now, you're gonna convert over open when this happens in the month of July. And then you won't have to worry about anything changing until the redetermination occurs. So if you didn't get one of the two letters that went out, it means you shouldn't have to set up a trust, and there's probably nothing for those specialized recovery services that they're looking at for that case.
the next question is, in your material and presentation, you're referring to individuals who are getting SSI. What about those who get SSDI?
So SSI is the only qualifier that would make someone automatically eligible based under the 1634 changes that we're going for. If someone's open on SSDI, then they likely meet the eligibility criteria for age-blind disabled. Then it's a matter of, do they meet the income and resources under the changes, which is the 75% of poverty instead of the 64. If it's over that, then they would potentially not be eligible for that base category of Medicaid. So that would be something we'd have to run through on the case when the redetermination is due to see exactly which categories they would or would not qualify for.
And the last question, those people that have a Medicaid trust, they have to look at that in view of also the Miller's Trust, or?
If you have resources now that you have set up properly in order to become eligible for Medicaid, and they were okay as resources based on eligibility now, those should not impact the eligibility in the changes. The only thing that will probably be an impact is if there are improper resource transfers or improper resources that are not disclosed that come out during any redetermination process. And then that Miller Trust would only become an issue if the income on a monthly basis is over that limit of $21.99. So again, if there are proper resources out there now, and Medicaid is open properly now, there should not be an impact from those.
So if someone made changes before looking at the Miller Trust, rewrite their Medicaid trust, they maybe not need to go over there with the Miller Trust?
If the income of the individual is over that $21.99 per month, the only way for Medicaid to remain open is to have another trust. So I wouldn't make changes with the intention of not having to set that up if you know your monthly income is over that limit.
Thank you.
You're welcome. Yeah. 330-451-8639.
I wanted to ask, in connection with the Medicaid versus the managed care, So would we not have to use the Medicaid card anymore and then have to pick a managed care plan?
My understanding is whenever it would kick over to everyone having to be on the managed care, there would be like a deadline for enrollment. And if that comes to fruition, I would just say that you want to make sure that you're picking based on your own informed decision. Because if you let the system pick one for you, you're very likely to end up with something that is going to be problematic based on your providers that you use. But once you're enrolled on there, there won't be a fee-for-service card that comes regularly. You would just use the plastic
Like a
managed
regular
care
insurance card
Yeah.
I would have. Will we be getting a list of providers that we can choose from so we can check with our physicians,
Yes.
et cetera?
Yes, and that should all go out in advance of any mandated enrollment. I am really not 100% clear on the ABD requirement for managed care. So I do have that question to put through to the policy people at Ohio Department of Medicaid. I'm going to ask them if there are any exceptions to required enrollment on managed care, and then is there an anticipated date that that would be required? So I'm not sure, I apologize.
I'd like to know where they came up with the name Miller Trust.
I am not sure, and you really would think that I would have cared enough to research that and know up to this point. I'm not sure. I'm sure it's named after some situation, but I don't know. Well, they're really going back and forth. At first, they only called it Miller Trust, and now they're calling it Qualifying Income Trust. Again, they rebrand about every 15 days. Yeah, I'm not sure where that name came from. I'm sorry.
Okay.
Anyone else have any questions? It's okay, no,
I do have a question. People seem to have such limited, so many limited choices and options when you deal with Buckeye and Source Care or whatever those places, agencies are called. Will Medicaid have any type of requirement for those providers so that they cannot refuse to pay for some of the medical procedures that current Medicare clients receive, individuals receive?
Sorry. My phone appeared to have a child in the ER as we speak. I apologize. I can't answer that firmly. What I can tell you is with managed care being a requirement for the MAGI population up to this point, so the families, children, pregnant women, expansion adults, anytime that we find situations where there's truly an access to care issue because of a managed care provider, we have a contact that we try to send information into the state because they have people consistently negotiating and working on the terms of the agreements with the managed care. They definitely have to abide by all the rules of the Affordable Care Act. So as far as, not denying for pre-existing conditions and all of those types of things that were put into place through that legislation. But that's not to say that we don't come across certain provider issues and things like that. So the methodology we've used up to this point is really to kind of be in constant contact with the state and the individuals who are tasked with working with the managed care providers to try to make sure that they're not having any of those black holes for things that need covered for individuals. That really probably doesn't answer your question firmly, but Medicaid's intention is to make sure that anything that would be covered under fee-for-service would be covered through their managed care plans. It's just sometimes a little bit tougher to make sure that everyone's on the same page. So, but if people come across that and you don't get any movement yourselves by dealing directly with a managed care provider, we can be a resource in trying to go right to the Ohio Department of Medicaid and kind of get them to help loosen things up and get things moving.
Just a quick question, for the waivers, how will that be changing for people that are going to the workshops? How does that exactly work?
I don't believe that there is any change in the process around the waivers. Now, I can't speak for whatever DD's role in the process is, But as far as the eligibility and the process, I'm not aware of any changes.
Go see about your kids.
Oh. Any other questions? All right, well, I will stay around for a few minutes. If anyone wants to ask me anything, and then also don't forget, if you'd like to receive any of the emails, to put your name and email address on the white